Now we turn to Dr. Halil Beqaj, who, although wasn't Zach's doctor, can help us better understand this case. Dr. Beqaj received his medical degree and master's in biomedical sciences from Columbia University. He is now a surgical resident at the Hospital of the University of Pennsylvania. He joins me now to talk a little bit more about this case. Good evening, Dr. Beqaj, and thank you for joining me.
Good afternoon, Vanessa. Thank you so much for having me on.
Now, I know you weren't his doctor on the case, but I know we kind of already briefly talked about what we're working and what we're talking about here, but just allow me to briefly fill you in again on Zach's condition. So he was born a healthy baby, and at 15 months old, he was diagnosed with what I referred to earlier as ADEM. Now, I was unaware of this, so I just did some brief research just to find that it affects 1 in every 125 to 250,000 people nationwide. And just to paint the picture for our viewers who aren't too familiar, that's extremely, extremely rare. So my first general question for you is, how does this happen?
It's a fantastic question. And to your point, most people have not heard about it because of how rare it is. But it is an autoimmune disease. So what does that mean? In the simplest of terms, autoimmune diseases are when our immune system, which is designed to protect us from outside infections, proteins, viruses, bacteria, ends up actually attacking itself, the own body. And so in this case, in acute disseminated encephalomyelitis, it is attacking the nervous system. So it is still kind of something that is being studied and still in the process of being better understood. But in kind of the simplest of terms, the way I like to think about it, a component of it is ultimately with a lot of autoimmune things, it's this complex interplay between genetics and the environment. The genetics being the genetic predisposition to one's immune system, and then the environment being an exposure such as to viruses or bacteria, which trigger this disease. So in ADEM, what happens, or what is thought, the theory behind what happens, is somebody develops a virus. In about a quarter of cases, they don't actually identify what the trigger is, but oftentimes it's a virus or a bacteria. And this causes then inflammation in the body, and this inflammation triggers your immune system, as it should. But what happens in this disease, due to the genetic predisposition of the individual person, the antibodies that identify, we call it an antigen, but let's say a protein from the virus to kill the virus, also identifies a similar protein in one's cells. So we call it molecular mimicry. That person happens to have an antibody that identifies both the viral antigen and the self-antigen. And then so what happens, and in this disease, it happens to be antigens of myelin. Myelin is kind of this insulation of nerves or neurons, insulation that allows neurons to propagate signal really efficiently. And so there's an antibody that both identifies the virus and the myelin, attacks both, then causes inflammation of the myelin. That's why it's a myelitis. And that then kind of leads to these nervous system symptoms and defects that these patients experience.
Right, so I know you talked about the genetic predispositions or qualities that these people with ADM have. Now, for example, are you saying that one person is more likely to get it compared to someone else who may not have any of those genetic predispositions, or is everyone pretty much at equal risk?
It is it's a very complex issue. The immune system is one of the most in terms of genetics most complex. It combines a lot of variability within how your genes work and assemble to create someone's genetic predisposition. And again, it is that kind of sweet spot between genetic predisposition and the environment. So yes, there are some people who have an increased risk or predisposition to this disease, but at the same time, somebody who has an increased risk might never experience whatever virus it is that would happen to have the antigen required to trigger it. So it really is a product of many factors. But there are people who have a predisposition in autoimmune across the board. Oftentimes, patients who have autoimmune diseases have family members or relatives with a history of autoimmune disease. So there is that genetic predisposition component.
Now, when I think of it, it kind of reminds me of multiple sclerosis. Is that kind of accurate to say, or MS? So what is the difference between these two, or is there a difference?
So I think one of the main differences that helps distinguish the two without getting into kind of the radiologic MRI findings, so on and so forth, is that ADM is usually monophasic, meaning they have it once and then it resolves to the extent that it resolves and it passes. It's a single episode most frequently. Whereas multiple sclerosis is usually a recurrent chronic disease where patients have these neurologic symptoms. They have these episodes over and over again.
Something else about ADEM. Now, it paralyzed his whole left side of his body. You know, the doctors thought he wouldn't make it. Are all cases of ADEM as severe as Zach's, or where it's a life or death situation? Or are there some cases where, you know, there's just people suffering minor reactions, or are all cases across the board this as severe?
So there's definitely a lot of heterogeneity in the presentation of the disease, but patients are always hospitalized. So it is a severe disease that requires hospitalization, requires IV medications for treatment and therapy. With that being said, there is certainly a broad variety of the severity of the disease. There are certain viruses that are associated with higher severity, requiring intensive care unit level care. There is about a 1 to 3% mortality rate. So there is a very small subset of people who from this disease actually die and pass away. So there is a very large and broad presentation and kind of symptomology that patients experience with ADEM.
I know you weren't with him or on this case, but it is so rare. So it's presumably difficult to treat. I don't know if I'm completely accurate when I say that. But now, if you were Zach's doctor, do you know how you would go about this, or kind of how you would approach this case?
So, excellent question. It's an acute disease, meaning sudden and severe onset. It presents pretty remarkably. Encephalopathy, encephalomyelitis, encephalo meaning brain. So usually patients have a brain neurologic component showing some sort of altered mental status, and then they can have the sensory and motor deficits like you mentioned, paralysis, people not being able to move the whole left side of their body. So often it's not missed. People present to the hospital, and then with the help of diagnostic modalities such as MRI and lumbar punctures, where you look at the fluid in someone's spinal cord and in the central nervous system, it can be identified and diagnosed. And fortunately, with treatments, heavy dose steroids, which suppress the immune system, IV immunoglobulin, and if also needed plasmapheresis, there are treatments. And in 50 to 3/4 of cases, oftentimes with this immediate early on hospital level treatment, patients can have a full recovery.
Lastly, that was such great information. I actually don't think I have any follow-up questions for you. Lastly, is there any research? I know you said that people are still researching, you know, there's still a lot of questions that aren't answered, but is there any research done already that supports how someone can perhaps prevent ADEM from happening or reduce the chances of happening, or not?
It's hard for me to speak upon specific research, but with the way medicine is going and the amount of innovation in general in the genetic genomics space of medicine, as that blows up, as technology becomes more readily available, as the resolution of technologies and identifying genes and even alleles or single nucleotide polymorphisms and these complex high-level analyses, especially as artificial intelligence gets involved, it would not surprise me if in the future we are able to identify people that might be, if they haven't already, at risk or predisposed for this disease. And so, you know, that's kind of the general direction medicine is headed in all fields of medicine. So it's something very exciting and something to look forward to.
This was such great information. I just want to thank you so much for joining me. I know you have a very busy week and a busy schedule, so thank you so much for your time, and hopefully we can talk again soon.
Absolutely. It was a pleasure. Thank you so much for having me on.